Hello, hello, hello. Hi, guys, and welcome to another episode of Bent Pages and Bending Bodies. I'm your hostess, Dr. Hannah P. And before we get into today's special episode, you already know what to do. Go ahead and like, follow, subscribe to this page. You can find me on Instagram at BPBB Podcast, like Bent Pages, Bending Bodies Podcast. You already know. BPBB Podcast. This video, is also available on YouTube. You can find the audio on Apple Podcasts and Spotify. So yeah. Also, guys, go ahead and tell your friends, tell your family members, I'm trying to get this platform out there. So share with people. I appreciate that. Thank you. Okay. So without further ado, I have a special guest again. She's a returning guest. As you may remember, her name is Leah. She is an OT. Sorry, hold on. Credentials. OTRL. Get it straight. Okay. Put respect on her name. If you guys don't remember, I'll give you like a little brief introduction. She is originally from Alaska. She went to Washington State. She practiced there for a little bit. And then she moved out to the Midwest, and hung out with me. And yeah. So without further ado, welcome, Leah. How are you doing, girl?
Good, how are you?
I need to give like a little round of applause, a little intro for you. How's the day been?
Good. It's been a busy day. Just another
Busy.
day in the life of being an OT.
So yes, guys, today's episode is all about the residency. And so I'm kind of like taking you guys through this journey, right? We were finding out what PT even is, and then we found out what OT was, right? We did the whole application process together. We talked about what is involved in PT school and OT school, like what to expect. And now we are talking about a post-professional program after PT school and OT school. So for physical therapists, the post-professional program we are discussing today for PTs is a residency program. And I didn't even know PTs had residencies. We'll talk about that more later. And then Leah completed what was called the OT fellowship. So they're pretty much, Leah, I would say they're pretty much the same thing,
Yeah.
right, girl? They're
Yeah,
the
very
same
comparable.
intensive
Yeah.
programs. But yeah, they're just a post-professional program to be able to specialize in a certain area. And so Leah and I chose to specialize in neurology. You guys have heard me talk about neurology, neurologic conditions. We're talking about stroke, brain injury, MS, Guillain-Barré, spinal cord injury, all of those types of things, right? Parkinson's, the list can go on and on and on, right? But yeah, Leah and I chose to pursue a residency slash fellowship program, and we just happened to be battle buddies, and that's how I met her. We were doing the program at the same time, and she was my person to lean on. So, whew, what an experience.
Yeah.
Leah, can you talk to us about what a fellowship even is?
Yeah. Yeah, so similar to Hannah, yep, I did the occupational therapy fellowship, and it's interesting that that's the kind of the verbiage and the lingo that is used. PT is typically called a residency, and OT is typically called a fellowship. That originated at some point, but that's kind of the differentiation there.
Like, I don't know.
So
Call both a fellow or residency and keep it moving,
right, it's the
right?
same concept, just different names, right?
Yeah.
We like to be distinct professions, I guess. So so a fellowship is basically I kind of thought of it as like field work like 2.0. It's kind of how it felt to me. So it's a fellowship can be something that you pursue for OT at any point after getting your degree. So sometimes you could be like Hannah was. I know she was fresh out of school, jumping right into the residency. And then I came in to the fellowship with 3.5 years of working experience and kind of wanted to take my skills and my professional expertise to the next level after having kind of been in the field already for 3.5 years. So it's a launching point, whether you do that launching point straight after school and just go straight from school to fellowship, that's option one, or you can work a couple years in the workforce and then do the fellowship. But essentially, it's a year-long intensive. where you're specializing in a certain area. There are like if you look on like AOTA, which is the American Occupational Therapy Association, that's our association for OT, our national certification or our national board. There are quite a few fellowships across the country. They have them listed by state, but I think for OT, it's still a relatively new concept and a new opportunity that's available to OTs. I think residencies have maybe been in existence for on the physical therapy side of things for a little bit longer. But basically, yes, it's if you have identified a certain area of population or interest or expertise that you're really wanting to hone in on and become more an expert in and more experience and more exposure to. It's committing to that year of devoting all your time, energy, and mental process to getting really immersed in that environment.
Yeah. In terms of physical therapy, I didn't even know that there were residency
Mhm.
programs. Whenever I would hear like a residency, I was like, oh, like for doctors, like medical doctors. Like, yes, I am considered a doctor, but like, medical doctors is where you would see a residency program. So I was happily surprised to learn that yeah, PTs can pursue a residency in, neurologic conditions like I did. They have orthopedic, pediatrics. I think there was a geriatric one when I was like looking up different residency programs. So there are tons out there. And so yeah, if you feel like you want a little bit more information about, a certain particular area of study, then I would encourage a residency.
Yeah.
Because guys, PT school, and I'm assuming OT school, it's kind of like an umbrella. Like you get the gist of most information about how to treat people, but listen, textbook and real life are so, so different. They're so different. And no patient is okay, I won't say no, but most patients are not a typical textbook case. And so I just felt like the residency really helped me kind of hone in on neurologic conditions and to feel more confident in treating these types of
Mhm.
patients. And so, yeah, anything else to add, Leah?
Yeah, I agree. I don't know if we'll probably go through our story of what
Right.
led us to our deciding the fellowship. But I definitely fellowships were never talked about in OT school. I've been out of school for 5 years now, so I know, yeah. So like in OT school 5 years ago, fellowships were not talked about. I don't know if they were in existence 5 years ago, but it's kind of something I was in a job search and a fellowship was mixed in with a job posting. And so I was like, oh, what's a fellowship? And went down that rabbit hole. So I feel like, especially for OT side of thing, it's kind of a little known opportunity, but something that can be super valuable for the right person at the right stage of their career. So,
Yeah. So actually, you just already like segue right
okay.
into my next question. Yeah.
Yeah.
So it was going to be, how did you even find out about this? So you
Yeah.
said a job posting.
Yeah.
Okay. So I guess then my next question, since you kind of already
Mhm.
told us, what did you think? Like when you first
Yeah.
read the description about a fellowship, excuse me, and what made you pursue like neurologic fellowship versus the other ones that are out there?
Yeah. So mine is I feel like kind of an aligning of the stars type of scenario where you're like, wow, things just kind of came into place. So long story short, I was planning this move to the Midwest for some family reasons. I wanted to come to the Midwest, and at the time, I kind of was on this like 6 month plan of like I need to start looking for a job. And at the time, I just randomly was on social media. We love social media for
Yep.
various things. And I happened to see like this news story about the particular facility that we did our residency and fellowship. And it was this success story. Like, this is a patient that came through this program, through the inpatient rehab program, and came out a success. And I was like, oh, this is super cool. It was just a random OT, or not OT, but just a random rehab story because I have
Yeah.
that on my feed. And I clicked on it and I was like, oh, this is in the area of the Midwest that I am looking to relocate to. And I found out the place that it was at and was like stuck that in the back of my mind, like, oh, that's kind of interesting. I
Aligning.
know, it was like the wheels were turning. And then a couple months later, when I was ready to start like applying for jobs, I was applying all over the Midwest, and I was like, let me just look at this hospital that was in this success story. And I was looking at the job postings, and in the middle of all the regular like OTR full time, OTR part time, PRN, was this fellowship opportunity. I was like, oh, that's interesting. Like, what's that? And it's funny because when I was applying for the program or through this position, I'd kind of reached this 3.5 year plateau, not plateau, but like point in my career as an OT where I felt relatively comfortable as like a general practitioner. I was working in acute care slash inpatient rehab, but I was like feeling like, okay, I feel like I kind of got my identity as an OT. I know what my role is on the team. I have the base knowledge to like be handed a schedule and be able to get through a day and successfully eval triage patients. But I was kind of feeling this like internal tug, like, but what's next? Like I had kind of considered what you get to this point where you're like, should I pursue another degree? In the case of OT, you can pursue a post-professional doctorate. And I was like, I don't know if I want to jump into something that large of a jump, right? And then, but I was like, I feel like I need more mentorship. I want to know more. I want to become more specialized. So then when I read the definition or the job posting, let's say, of the fellowship, it was exactly what I wanted and didn't know even existed, basically. So kind of reading that, I was like, wow, this is what my heart was looking for as far as professional advancement, mentorship, continuing to carry a caseload, being a mentor to others. We'll probably get into all the nitty gritty, but
Yeah.
so that's kind of how I came upon it. And I put in an application and interviewed from halfway across the country, and the rest is history. So
Yeah.
yeah.
Well, I like like you said, I feel like the stars aligned. It was meant
Yeah.
to happen. Especially since you were
Uh-huh.
already planning to move out here anyway,
Yeah. Mhm.
for personal reasons and just looking for the job.
Yeah.
Yeah, and then you end up staying. So I think that that was like awesome.
Here.
Very
Yeah.
awesome. Yeah,
Yeah.
I would say that my experience is a little different than Leah's. So, like
Yeah.
she said, she was already out of school, already practicing, whereas, yeah, girl. um, so I was actually in my last year PT school. We had like 2 8-week rotations. We had to come back to school. Oh my gosh. That part was annoying. But anyway, it's a different podcast. So we came back to school and then we had 2 more rotations to do to kind of like finish out our degree, right? Well, in that brief time where we were back to school, we had this program come to talk to us about like, hey, are you interested in pursuing a residency? I was like, Bird, PT school, PTs have residencies? Why? And then I already really had like a love for neurologic conditions like in school, just from my personal life and just like from what I had learned in my classes, I was like, yep, I want to go into neuro. But unfortunately, my school did not really, it was like really orthopedic based. And so when we say ortho, guys, we mean like as a PT, I was going to be treating backs, shoulders, knees, backs, shoulders, knees, the occasional elbow. But like it was going to be really mundane for me, is what I felt. I didn't really click with ortho or the joints, anything like that. I'm just like, that's minor stuff. I want to work with like stroke, brain injury, the heavy stuff is what I was thinking. Um, that's just something I personally connected with. And so anyway, we had the program directors come to our, I think it was actually on Zoom. I was telling Leah before this, I was like, I remember like I wanted to, apply for this or just like find out what it was about. And so I was like in the classroom, I was like in a small little corner with my headphones on, trying to hear the program director like talk to me about what is a neurologic residency, what to expect. And I'm like trying to hear her. I'm like, uh-huh, okay, but it was like, I don't know. I just was learning about the residency and I was like, you know what? I think this is for me. And I was like, okay, so, when are applications due? And I believe it was like within 4 to 6 weeks where guys, 4 to 6 weeks is not a long time. I said, what? Okay, I was like researching, I was getting on it, because we'll talk about this later, but to apply, you need like letters of recommendation, you need your cover letter and resume. Like there are different things you need to build up your application. And I was like, oh my gosh, I don't know if I have time. And so the theme of my career has been, hey, let's learn as we go. So I was literally learning about the residency as I was applying. And that's how I found out about it. But like Leah said, I think that the stars aligned, everything happens for a reason. And yeah, it was a tough program, but ultimately I am so so glad that I did pursue it. And actually another member of my cohort, they also pursued a residency. I think this was down in the South. Their residency program was a little bit different, and I need to check in with them to see if he finished, but he took a little break because guys, the residency is intense. So anyway, there are residency programs all around the country. That site that I mentioned to you guys, PT Cast, to apply to PT school. Oh, I should have looked this up before I got on here. But they also have a residency part of that same site, right? And so in that site, PTCast, I think there's like a couple more letterings after, and I'll give it to you at the end of this episode. But that's the site that I use. That's the site that I use to like build my application. The same things, like the same list I kind of talked to you guys about with applying to PT school, they had similar lists, right? So you can see like where it is, when the program starts, what are the prerequisites, all that kind of stuff. And I applied to a couple. No, I don't think I did. That was a lie. I'm sorry. I really think I only applied to one. Honestly, I knew that this was the one. I was like, we're going.
Wow.
This was also a program, personally, that I had heard about this facility throughout my time in school. So they would always use this program to kind of like highlight, like, here are patient success stories, here's the place to be. And I was
Yeah.
like, dude, one, I used to get a rotation there, which I ended up securing, which was awesome. And then I was like, okay, then I found out they had a residency program. I was like, oh, heck yeah. Like I need to like build connections at this facility. So yeah, that's just a little bit about the residency background.
Yeah, I think it's so interesting that I think it's another example of PT being several steps ahead in the development and like establishment of residencies. So, like OTCAS is, you've got
Yeah,
PTCAS, I think, and
PCAS.
OTCAS is
Yeah.
the platform that we use for applying for OT school. But to my knowledge, fellowships are not integrated into OTCAS. For my situation, Hannah and I were at the same facility for residency and fellowship, but it was actually the inaugural year for the OT fellowship at mine. So I was like the very
It was
first,
the first.
yeah, a first of one. Um,
It was number
so
one.
yeah, it was the very first. So to my knowledge, and I can give Hannah a link to this to include with her PTCast link, but you can go onto like again AOTA, which is our big body, and they just have a list. It's like by state.
Mhm.
So it's kind of helpful if you're like looking, you're not like, oh, I know I want only in these states, and it lists fellowships in each of those areas. So that's the only like organizational like find it all in one place that I'm aware of. I did actually apply to two fellowships, both in the Midwest.
Nice.
I just got through the application and interview process a little bit faster with this one. I got accepted for an interview for the other one, but this one just moved quicker. And I was like, I'm going where I know I for sure have a spot, which was this one. So
That's awesome.
yeah, there are a couple I feel like for OT just like in this area too. So
No, I found some, like, I
mhm.
think somewhere in the Midwest, somewhere like
Yes.
down south that I was gonna have
Mhm.
to move.
Yep.
Um, and honestly, I think I was looking into things. I was like, you know what? I don't typically do this, but we're pouring all the eggs in
Yep.
one
Hmm.
basket,
Yeah.
like
Yeah.
one. And
Absolutely.
I'm like 99% sure this was the only one that I applied to,
Yeah.
which
Yeah.
that's
Yeah.
not me at all. Cause I'm always like, oh, I don't know if I'm gonna get it in. Let me just kind of
Yeah.
spread. No, I was like, this is the one. This is the one.
Yeah.
So, Leah, let's talk a little bit about what is the structure like for an OT fellowship, especially one that involves a neurologic like the neurologic component to it?
Yes, excellent question. So the disclaimer obviously is that all fellowship programs are a little bit different. So I only have the experience of this one. But for our fellowship, and Hannah and I have, there's definitely the big structure of them are very similar, but then the nitty gritty, of course, is different. But for the fellowship, we had 4 rotations. So it's kind of like having 4 specialties that you rotate through across the full year. It's exactly a full year, 12 months. So the first quarter was a stroke rotation. The second quarter was a brain injury and multi-trauma rotation. The third rotation was spinal cord injury. And then the fourth rotation was kind of tying all the loose ends together, and it was outpatient OT, but with the expectation that you would mostly be seeing those primary neuro diagnoses that you had seen throughout the other months of the year. So that's like the big part, right? So is the patients and the diagnoses you're seeing and rotating throughout the year. The other piece of it is that you do carry a caseload. So you carry the great thing about it is that you carry half a caseload, which at face value, you're like, oh, great, that's very doable, which yes, it is very doable. So for me, I would see patients from 7:30 to 11:30 every morning. My caseload was a caseload of 4. A primary or full-time therapist would usually carry a caseload of 6. So caseload of 4 out of a typical primary caseload of 6. So that's piece one, is the clinical diagnoses aspect, is you're carrying a caseload. Area 2 is kind of the professional development that you're providing to the employees and the facility as a whole. So we were responsible for every month, we were responsible for hosting and leading a journal club as well as a case review. The case review is basically us picking someone from our caseload and doing a really deep dive into that case, the diagnoses, the background, the interventions, and the scholarly research out there to support the interventions that we were choosing or the decisions we were making. And so we would create that case study and then lead that. So it was a journal club and a case study every month. And then we are also a part of the new hires. So I thought this was a really cool interdisciplinary piece because we got to interface with all the new hire nursing staff and teach them like some of our therapy, new things that we wanted new nurses and nurse techs to know from a therapy perspective. So we were doing that a couple times a month. So that was kind of the next piece, is like, what professional development can you provide and insert into the staff as a whole and the facility as a whole as the OT fellow or the resident, PT resident. And then there's the next piece is the kind of like the academia piece, which is kind of an exciting piece to be able to be a part of. So we were partnered with a local OT school here. And so I got to, for basically the whole school year, not including the summer, but I got to be a kind of like I wasn't like, I think they called it an adjunct faculty member. So definitely like a guest, kind of
Oh.
guest status, but not, full on professor or anything. But adjunct faculty, where I got to do my own, do a full on lecture, like a full like 4-hour lecture, but then also was like a part of their labs and answering questions and interfacing with students during a course from like that full fall semester. And then in the spring, I was supervising students in their student-run neurological clinic, and that was, grading their interventions and their evaluations and giving them feedback on what they were providing to those community-based patients. So that's, what are we at? That's leg 3 of it. Leg 4 is pursuing your own professional growth through ongoing like continuing education. You're assigned various continuing education that you have to complete throughout the year, as well as coursework that coincides with the population that you're seeing. So it's kind of like, it's basically like being in school and having like classes that you have to keep up with. So that's area 4. I think there's like 6 basically. So area 5 was just like Other like extracurriculars that you have the chance to do that ordinarily you wouldn't get to do if you were a standard employee. So we got to round with the primary doctors that were for each of the units we were on, rounding with them, seeing what they talk about with each of their patients as they go through, and then also seeing what they do when they transition with the patient to outpatient. We got to do rotations in other like community settings and acute care, and then another inpatient rehab facility locally. Um, so that's kind of this other like observational, like we are going above and beyond to get to observe things that you would ordinarily have the opportunity to observe. And then the sixth piece, well, the sixth, let's go for a small sixth piece. You also were expected to do volunteerism throughout. So there's, volunteering, so many things in the community that are based in like disability advocacy or disability and working with the populations that we interface with as therapists. So there was some volunteer expectations.
Yes.
Step seven, I didn't
Like
realize there was
three
going
of
to be
them.
seven pieces, but I'm kind of stealing some of Hannah's thunder, but she'll
No,
have less to
go
talk
for it.
about.
Go for it. You're doing a great
Um,
job.
Step seven, the biggest and most daunting piece is the expectation of completing our own research. So
Oof.
for this particular, I know, see, Hannah and I are still a little bit scarred, but for this piece, we were expected to do some type of research, see it all the way from start to finish. I personally chose to do more of a case study, uh, type of scenario where I chose the patient and really analyze their interventions and their full plan of care, what we did, how we did it, and kind of drawing conclusions based off of that, and to contribute that to the research. And that culminates into not only a full APA, all the good stuff research paper that's many, many pages long, but also what we call a grand rounds presentation, where at the time, because of, still ongoing COVID things, it was virtual, but giving a hour-long presentation about our research that could be attended by interdisciplinary members of our facility for continuing education credit. So with the expectation for the OT, our expectation was to pursue publication in a journal. So that was something that I had to pursue and work on post fellowship. Luckily, that's already completed, so we can talk about that later.
Yeah.
I think I thought of something else as we went along, but I guess there's 7 parts. So those are all of the things.
All of the things.
But I feel like hopefully I outlined it pretty well. I feel like Hannah will be able to piggyback on it because
Yeah,
again, the OT and PT, the structure is similar because we're at the same facility. So
100%. Yeah.
yeah,
I would say the the only difference
yeah,
really from what we did together was, so Leah mentioned her rotations. Her last rotation was like more of that outpatient, kind of like generalized, but more focusing on still neurologic patients. Whereas for my rotations, like she mentioned, we did stroke, we did brain injury, spinal cord injury, and then there was a rotation for outpatient, which was like post concussion and vestibular conditions in terms of PT. So that's basically the only difference. But everything else that Leah said, oh yes, oh yes, it was involved in the PT one too. Yes,
yeah,
yes.
yes.
Yeah, and
Forgot
the
a piece too.
he said what? I'm sorry.
I said I forgot a piece too. I will.
Oh, what piece was that?
I guess interwoven in it. So the big thing is the mentorship. So
Yes, 100%.
so with
Yeah.
each of the 4 rotations, you're assigned a mentor that is your go-to person. And then as like the perks of the fellowship or the residency, that's built into your schedule that you're supposed to meet with this mentor a certain number of times a week so that you work on certain cases together and they can give you feedback. And that's a whole process. But ultimately, you have built-in, dedicated, specific time with the mentor that you're expected to interface with them and receive feedback and all that. So that's the other component, not really a leg, but a component of it, obviously. So
I will say that's probably one of the biggest reasons I pursued the residency. And then, like, looking back, I wish I had maybe taken more advantage of. I mean, I think I am the one that always will ask questions, always have something to ask of my mentors, but there are other areas where I feel like I could have probably leaned on them a little bit more.
mhm.
But anyway, that was the mentorship was a big component of why I was even pursuing a residency, right? Because I was like, listen, Hannah, you just graduated. Your school
Yeah.
does not really go into neurology like you want. And if you want to work with an individual with a brain injury, where do you even start? I was like, I don't know. You know what I mean? And so I just felt like, okay, I want to get into neurology. But I don't know how to do it. And so the mentorship program was something that I really was like, okay, this is great. I'm working, but there's also still that school like didactic component, right? Where I get to learn more about the conditions, like you said, that we're working with, the populations we're serving. And then I also like, hey, I saw this in the research, I saw this in our studies. What does this mean? How does this apply to our patients? Or another part of the mentorship program was it can kind of be a little bit unnerving sometimes, but they would join into our sessions, right? And, initially it'd be kind of like, okay, a little extra pressure, kind of sweating a little bit as you're working with your patient while somebody's like watching in the background, right? But I feel like all of the mentors were very helpful. Um, I mean, there was pressure, right? But there was kind of like, hey, do your thing. We'll talk about it after, right? Or there were moments I was like, hey, actually, mentor, can you step in real quick? Can you, ambulate, walk with this patient? That way I can see what is going on, right? How can I make this better? And so that was a really cool aspect I thought was just to have that person there who is skilled, who has been doing this for years on end. Not to okay, sorry, that was rude. They're not old at all, but they just have so much experience and they're so knowledgeable, and it makes you feel like they've been doing this forever, right? They were they were born a PT, you know what I mean? That's how skillful and knowledgeable these people are, right? Um, but you just have this person that you can just be like, okay, this is what I'm thinking, but I don't know how to go further. Or this is what I'm thinking. I don't know if I'm on the right path. Should I pivot? Or like I just said, where, hey, can you step in? That way I can kind of see the larger picture that's at hand. So I really, really appreciate the mentor program. Like I said, looking back, I wish I had leaned into it a little bit more. There are questions now that like when I face somebody, I'm like, that would have been a good question for a mentor when you had one. But hey, we move on, we learn, we grow. But yeah, I appreciate you said the mentor program because that was a big part of why I even went towards the residency because I was like, I need to learn more before I try
Mhm.
to work with, these people, like these brain
Yeah.
injury or this, because you have somebody's life in your hands, right? That's what it feels like sometimes. You have the fate of their recovery, the fate of their, obviously it depends on other clinicians and just the impact of whatever severity of impairment they have. But at the time, you're like, if this person walks or not, it's because of me. Am I
Yeah.
pushing this person hard enough? Am I doing what I need to do to get this person where they need to be? Like, I want this person to go home, right? Not to a nursing home. Am I doing everything in my power and my toolbox to be able to provide for this person and help them to succeed? You know what I mean? So it's a lot of pressure, especially
Yeah.
with these major injuries. Like, no shade to people who do like orthopedics, but okay, your shoulder hurts, right? Like we can kind of keep working on that week to week, but you're still able to function, able to go about most of your daily life, right? But if you have a stroke, if you have a spinal cord injury, like you are severely impacted, right? And so it's a lot of pressure to be able to like walk, like to navigate that person through their recovery. And I just really appreciate leaning on our
Yeah.
mentors for that because I was like, I don't know how to do it.
Absolutely. And
Yeah.
I would say too, from the perspective of like a non-new grad, like a 3.5-year-old, if we want to put it that way. But I had noticed, like, I feel like as a new grad, when you have that title after your name, even though it's not a title, but it's a known thing when everyone has to be a new grad at some point. So I think when you get into the workforce, there's always going to be people that are going to do all in their power to mentor you and to support you. But at the end of the day, those people that are there to mentor and support you have their own caseloads and their own productivity and their own standards that they're having to meet too. And that's kind of the glass ceiling, I guess you could say, that I was finding myself in the job that I had. Like I had wonderful mentors. I to this day really appreciate them. But it was kind of this juggling act where they were like, noticed that I was a new grad, identified areas that they felt I needed and could benefit from mentorship in, and were trying to like balance that, like carry their own caseload, but also mentor me and try to impart knowledge to me. But at the end of the day, it's like stuck between a rock and a hard place because they have to meet their productivity standards too. So I feel like I was like, okay, I need more mentorship. I feel that I need more mentorship. And a fellowship is like such a structured experience where the mentorship, you are assigned a mentor and they have time blocked in their schedule for the mentorship, and they come into it with this background and this knowledge and specific training on how to be a mentor for you. And it's a much more structured and organized situation where you're going to have that undevoted time that you probably it's hard to get,
And other
regardless
side.
of how wonderful the mentors are that are trying to help you. It's hard to get in a traditional work setting where they're adding it as like an extra mile that they're going for you. So
Yeah.
I had just gotten to that point where I was like, I want more, I need more, but what's a structured environment that I can go into where I can receive the mentorship that I need? And then this is it.
Yeah.
So yeah.
And like you said, it was literally built into their schedules, right?
Yeah.
So if I remember correctly, they had
Mhm.
to join at least two of our sessions each
Yep.
week.
Yep.
We would have a pre-mentor and a post-mentor meeting. So pre-mentor is obviously before. And so we'd go in, hey, you're gonna watch me with such and such patient. Here are the like, okay, so first of all, we were talking about the ICF model all the
Yeah.
time. And I was like, man, why did my school not utilize this? Like it could have been utilized in so many
Mhm.
patient case studies, just interwoven, but it wasn't. And so again, this was another learning experience, another hurdle that I had to go through, and just kind of figuring out how to really hone in my ICF model, which, guys, that's basically just looking at a person, at the whole picture of a person, right? It's not just their diagnosis, right? Because yes, you can have the same diagnosis, but the outlook and your potential for recovery and just your overall, like our interventions are going to be different for each person, because we tailor things to people, right? We don't just do generic interventions. And so the ICF model looks into, okay, this is what is affected in terms of your mobility, your strength, your battle, whatever, all the things. It also talks about that person's home life. Here are some barriers, but also here are some strengths, right? This person has a huge support system. They have many family members, many friends that can come and check in on them, or to stay with them if they need supervision, right? Whereas another person might have the same diagnosis, but maybe they have very little family support. That's a completely different picture for those two individuals. We also talk about their, environmental barriers and strengths, right? So, an individual who has a hard time walking, who can't do stairs, if they live in a ranch style home versus somebody who lives on the fifth floor without an elevator, again, two very different pictures, right? And so this model, I utilized it every single week. But this model really kind of helped me not only break down the patient, but just look at all the things that I need to be working on in terms of their interventions. So anyway, so in the pre mentor meeting, we talk about that, right? I go over their different impairments and their strengths and their barriers. Here are the interventions I'm planning on. And then I would also have the chance to ask questions, right? So this is what I'm thinking, but like, let's talk about XYZ factors, right? Whether that was, the plan for discharging and the different components I need to get in order for them to have a safe discharge, or whether it was just like not usually about their condition, because that's something that I could find in the research or in my didactic studies, but just, I guess, overall questions that I might have regarding this patient, or like, hey, the research says this, I have been trying this and it's just not working,
Mhm.
or I just feel like this is where I'm getting stuck. And so it's always nice to have like I said, that mentorship. So you have that pre-mentor meeting, and then you would complete your, your session with that patient, and then you would schedule a post-mentor meeting, and that you would just talk about, hey, this is what I think went well in that session. These are the things I can still work on. And it really just gets you thinking as a clinician, like how, like in the moment and after how can I just be better, right? What are the things I can change? Like if this wasn't going my way, they would really try to hone in like thinking on spot and thinking
Yep.
like afterwards, right? And so
Yep.
I think that the mentorship, the meetings before and after just gave you that, helped you out with figuring out in the moment, what is it that I can change to make this go better? This type of walking is not what I'm like looking for, right? There's something off. Is there something I can change? Is there a different cue that I can give? Is there a different device, different support system? Can I guard a different way to make this be just a little bit more successful for that person? And so yeah, I really enjoyed the mentorship. Like I said, I could have leaned on them more. Your girl was running out of gas at the end, but I definitely appreciate all the mentors, so shout out to them. Anything else that you have to say about the mentorship program?
Yeah, I think that was a beautiful explanation of the mentorship and how that works. Definitely something that's basically, I don't think I put it as a leg because it's just woven in throughout the entire fellowship residency. The only thing that I have to add from the OT side of things is if you're an OT and you're listening to this, or an OT student, and you're like, what's the ICF? Our comparable is the OT practice framework, OTPF. It's basically comparable structured ways of looking at a patient in a case. But if you were listening to that and you're like, what is she talking about with the ICF? If you're an OT, it's the OTPF, Occupational Therapy Practice Framework. Very similar, oh, hey, similar, comparable language to the ICF for the OT side of things. So
Yeah.
just a little shout out for OT lingo there.
Thank you guys. This is why it's so nice to have an OT and a PT on the podcast. Then we can just give it to you straight right here,
Yeah.
Okay, so we talked about the structure. Let's kind of go back a little bit and talk about just like what is the application process like in
Yeah.
terms of, yeah, applying to a residency program slash fellowship program.
Yeah. So for this particular, and it sounds like maybe Hannah's experience was maybe a little bit different than mine, because it sounds like you maybe used a different um like
Interface.
interface to do it. So with mine, it was application through, as if I was applying to a job through the facility.
Mm-hmm.
So we didn't have, like I was saying earlier, where Hannah was saying that APTA is or not APTA, PTCAS is kind of integrated into the whole residency programs across the country. OT is still in that development phase of fellowships, so it's not interfaced with OTCAS. So I just applied directly on the facility website as if I was applying for a job, which is what this was. But the big components of mine, just like Hannah was alluding to at the very beginning, just like you just think about any other therapy job that you might be applying to. You got to tell about your work experience if you have any, and you're not and you're a new grad or have been working. Your resume, making sure that's polished and appropriate, and then like having some letters of recommendation too. But I think the biggest piece, and Hannah and I were just talking about how we went back in time a little bit and looked at our applications for our residency and fellowships in preparation for this. But I think the big aspect was the cover letter. So I know for the OT application, and I'd have to look at the exact specifications of what they asked of us, but they said, the cover letter is where you can really shine. So they can look at a resume, they can look at, where you've worked and what school you went to and what degree you came out with. But in the end, that's not going to tell them like why you're passionate about the specific specialty, why you want to do a fellowship, and why they should pick you. So the cover letter, they did have some structure to it. It's like, do this cover letter, be sure to hit these specific points. And so my cover letter in particular, it kind of gave this background, like this is why I'm pursuing a fellowship. This is the background that I have, and this is why I feel like a fellowship would be supportive of my development as a professional and my contribution to the program. And then it also gives you a chance to like write a little bit more and describe a little bit about more what you've done in the past, maybe if you've done some research or you've had unique experiences that kind of set you apart. So the cover letter, just like kind of like this, that, when you're applying to OT or PT school and you're saying like, why do I want to become a PT or why do I want to become an OT? This is why do I want to become a fellow and why should they pick you over the other residents or fellows that are applying. So I think the golden item there out of all of it that you have the most control over and kind of have the fate of your acceptance in your hands is that cover letter. And then it also has just the nitty gritty of any other job application, really. So,
Yeah. Sorry. Well, just looked it up real quick.
oh, good, good.
So long. So you're okay. It's part of PT Cast, right? But the official like name that you're looking for is ABPTREF. I was like, oh my gosh.
Wow.
It's the American Board of Physical Therapy Education Residency. So it's a pretty long title. But yeah, that's kind of what I applied through. I think that after I was accepted, that's when I did like the job post that you're
Oh,
talking
interesting.
about.
Okay.
Yeah,
Yeah.
so I first had to go like submit through the
Mhm.
official website.
Okay.
And then, we went through the interview process. We'll
Yeah.
talk about
Oh, I forgot about. How
it.
could I
I don't
forget?
know, it's
Right?
okay. Interview process, you have to wait. It's like, oh, I don't like to wait about the
Yeah.
I don't think it was too long. I think that from the time I did my interview until when I heard was maybe like I've like within a week or
Yeah.
so.
It was
It was
pretty
it
quick.
was pretty quick. I was
Yeah.
actually very surprised.
Yeah.
But it was within a week, and I was actually a student at that facility too.
Oh,
Yeah,
that's so
during my
cool.
rotation, I was a student there and I had already applied, and
Yeah.
I remember like I think it was around lunch or something. And so I was done, with my stuff. And I was like, oh my gosh, this facility is calling me. Hold on. Hold on. I was like,
Ah!
prepare yourself. And then I was like, hello, they're offer you the residency. I was like,
Ah!
I was like, but
Yeah.
yeah, yeah, it was great. Yeah, real quick. Okay, let's go ahead and start the interview process. So,
Mhm.
like Leah mentioned, yeah, the cover letter I feel like is where I really shined. You guys know me. Well, actually, in PT school, I had really, really good grades, right? I had actually a lot of accolades. I was a GA. I had won, fun fact about your girl. I won outstanding student, right? And it's literally in the description, it says for the pursuit of lifelong knowledge. And I was like, I'm
Oh,
a lifelong learner, and to pursue
yeah.
more information and get more information so I can be the best clinician I can. Um, so I made sure to put that on there.
Yes.
Yeah, reading my cover letter, I was like, oh, Hannah, you had no idea what you're getting into. It's
Yeah.
okay because it worked out. We're on the other side. But yeah, the interview process, I don't know if it was like this for you, Leah, but this was the first time I had ever had like a platform, like a board interview me, right? So I
Mhm.
remember the first set of interviews were on Zoom and they gave me like patient case that I was like so nervous, dude. But they gave me or sorry, case studies. And
Yeah.
I think that like looking back actually at least two of the people that were on there were my mentors. The
Mhm.
third was my scientific inquiry,
Oh, yes.
yeah, professional. I don't know whether to call her like a teacher, adjunct professor. She was a part of the residency. She was like assistant director, I believe. Um, but yeah, she was also there. Like looking back, I'm like, oh my gosh, like
Yeah. It's intimidating.
whoa, But yeah, so they were all on the platform. I think there was one other individual as well. I'll be honest, I don't remember who that was. But yeah, I just remember they gave me like some patient case scenarios, and I was like, oh, I would do this. I would use XYZ test, and they were like, okay. Like, I don't know how to read these people. I don't know. And then, yeah, they were like, okay, we'd love to interview you in person. I was like, okay, like sweating a little bit. Yeah, and so the interview process was like me and I think five other individuals. Again, two of them happened to be my upcoming mentors. And then I think the scientific inquiry, I don't know if she was there or not. Like it's a blur, when like
It
things
is
go,
a blur.
you're like, I don't know how I got through that. Yeah, I don't know. But I do remember like two other individuals were there. I think one had been a mentor who had like stepped down for a little bit,
Mhm.
but still a part of the application process. Oh, actually, I'm sorry. It was three of my mentors because the other one, she had like done a similar path that I was pursuing, right? She had been a student, she had been the resident, and then she worked at this facility. And I was like, yep, I'm gonna be like that, And so she was
Mhm.
also there. And I remember that was a really cool because I was like, okay, kind of I just was like asking her questions about because I was pursuing the same path, and I was like, oh, like what are some things that are different now that you work here versus being the resident? And she was like able to be, pretty candid about that. Yeah, but I just remember like, man, I was so nervous. I was like, this is a panel of judges, if you will. When I was like,
Uh,
I don't know, but when I heard back about like after I was already a resident, um, I heard they were like, "Oh yeah, you were so confident in your interview." I was like, "Huh? Hope you don't." Okay. I was like, "Well, I'm glad that I faked it." Because
That's it, right?
the wedding, like my hand, I was like, twiddling my fingers. I was like, "Okay, Hannah, just don't sound stupid." But how was your interview process?
Yeah, so mine was like a little bit different, and I'm questioning how many levels of interviews I had because I interviewed for this Midwest position from Washington State, so I did 100% of it virtually. And I think Hannah, didn't you get a tour of the facility too? Well, you were
Mm-hmm.
already a student there,
I was a
but I
student,
think
but actually after my interview, I did get a
they
tour
gave it.
of
Yeah, so that
the
was like a bonus that I did not get because I was halfway across the country. But um yeah, so that's the beauty of Zoom, right? Like what we're doing right now. Like
right.
you can interview for fellowship positions or residencies that are far, far away, which our current fellow who is in the position that I was in now also came from halfway across the country. And I think
Oh
the next
wow,
one
I
is
didn't know
coming
that.
from far away. So that don't let it deter you. I mean, it's a big leap and a big commitment, but to, dream big and look for fellowships that are far away because Zoom is your best friend when it comes to interviewing. So yeah.
Nice. Did you have like any jitters or what can you give as advice to people who are looking to pursue a
Yeah.
residency and acing their interview?
Yeah, I think especially and this would apply to like any jobs as an OT. I think um just as you're preparing for like a fellowship interview, I mean, you're obviously not going to know exactly what questions they're going to ask, but they're probably going to ask you some questions about examples of patient examples or experiences that you've had with patients. So I think coming into an interview like that with I mean, you're not going to know what spin they're going to put it on, whether it was a positive or a negative or a heartwarming or, a triumphant experience or something like that. But I think having a couple like patient experiences top of mind is really helpful. Like at the time, like had some fresh in my mind that I was like, oh, these scenarios were really impactful to me for XYZ reason. And so you can kind of come with those in mind. Um, and I guess I just realized if you're a student or coming in, I think you can still come with those in mind.
Mhm.
Think about patient experiences that you've done in your field work for OT. And then if you're coming in as a clinician, certainly think of experiences because I think that's really where you can shine as a potential fellow is, they can see what your thought process is, what your therapeutic use of self is. And also like it's just a window into like your passion for the profession. I think when that's the meat of that's the heart of it, that's why we do what we do is because of the patient care. So I think at the heart of it, if you come with these experiences or these opportunities to share about the patients that you've impacted or if they've impacted you, that's your opportunity to authentically show them like, I'm really passionate about the being a therapist and I want to be better and this is what I've learned from it. And I think it shows some humility too, and recognizing I've had these experiences. I know I could have done better and I've reflected upon them. So I think, I guess that would be my best advice. They're going to throw, it's just like preparing for any interview. You know that they're going to throw questions that you're not going to be prepared for. But if I think that would be the biggest thing is just come with some particular patient experiences in mind, like a little album of patient experiences in the back of your mind that you might be able to spin however way they're trying to ask you to look at it.
I totally agree with that
Yeah.
because I like when you talked about like humility, right?
Yes.
I personally am a person rarely rarely get embarrassed. Rarely, I'm just like, hey, I don't know this, or this is
Mhm.
where like my shortcoming is, right? I don't mind giving that information. And so I distinctly remember like in my interview, there
Mhm.
were areas I was like, look, I'm not the strongest in this, and this is why I'm pursuing this, right?
Right.
Because I know that this is like my weakness. I know that I don't have the knowledge, the expertise to be able to work with, these populations or to be the best clinician that I can be at this time, and I
Yeah.
think that they really appreciated that. I think that in sharing some of my faults,
Mhm.
also being that new grad, or I hadn't even graduated at the time, still in school,
Yeah.
but I think that it kind of helped because it's not like I was a mind that was already molded into my practice and super rigid and I wasn't going to be willing to change. I'm like, hey, teach me and I'll learn, right? Like
Yeah.
mold me into a better clinician, right?
Yeah.
Um and so I think that, for individuals who are looking to go from one setting to the next, a residency program is a great opportunity for you. I also think that for new grads, right? I think that because, OT school and PT school can be that kind of umbrella, just giving you that generalized information. If you want to specialize, a residency is perfect because it's like, hey, I'm not so set in my ways yet that I can't learn new information. I'm not set in my ways where I can't apply and research and do what's the best clinical practice out there, right? Um, yeah, so I totally agree with that. I think it made us humble. Um,
Mhm. I think
for
I just
sure.
had a thought pop up as you were saying this, and I'll do this one really quick. But I think it's a very unique interview because if
Mhm.
you think about when you're interviewing for OT school or when you're interviewing for a job, you're selling yourself as this is all the knowledge that I can bring and contribute to you, like specifically for a job. This is all the experience I have. This is all the knowledge I have. This is why I have more knowledge or experiences than the other person. But this is kind of a unique scenario because you're presenting yourself as I've identified that I don't have all the knowledge that
Mhm.
I want to have, or I am presenting to myself to you and knowing that there are holes in the knowledge that I would like to have. So it's kind of unique because if you think about it, when you're doing a job, you're like, got to show yourself this polished, like,
Right.
I
Yeah.
know what I need to know to be the best for you. And that's still, they want to see like someone who's motivated and someone who, has done the hard work to get themselves to the point of being ready for a fellowship. So, there's all that background, the resume and all that. But at the end of the day, like Hannah was just saying, it's presenting yourself as I'm someone who's really eager to learn. I'm someone who's excited about advancing in my career. I acknowledge that there's areas that I really want to grow in and I want to learn from. So I think it's kind of it's a unique interview in that you're highlighting your strengths and the things that you've done and all the monuments and milestones that you've accomplished, but you're also like shining a pretty big light on these are the areas that I need to work on, and this is why I'm coming to your program is because I want to fill those holes and I want to get better in those areas.
Exactly. Yeah.
Yeah,
Yeah.
just a light bulb moment.
No, and I would say, kind of coming back to one of the points you mentioned, obviously looking up questions.
Mhm.
So I remember like preparing for this interview. I looked at like what are typical questions they might ask you, or just to kind of like better familiarize yourself, prepare yourself, phrase your wording and your response as well. All the things kind of that we talked about in the not last, but in a previous podcast when you're interviewing for PT school, it's like the same but more.
Yeah.
Way
Yeah.
more. But yeah, I would just say preparation is key. Humble yourself, like we just talked about, don't be afraid to share those areas where you feel like you're lacking in knowledge, right? Like one of the big things I was lacking is about research. I've never been super gleeful about doing research. That's just something that I tend to struggle with personally. What are the key phrases to look up a certain article? Just research in general, kind of reading the whole article and not just the abstract, right? And then getting a good idea of like, what does this information have to tell me and how can I apply it to my clinical practice? And in my program, unfortunately, we were in that COVID era, right? And so we were not able to do our research in person. And so we actually had to use the data from the previous cohort. We had to use their studies. And so it was a lot of just like reading and research that way, but it wasn't me actually applying anything. And so that was just one of the areas I told them. I was like, hey, I'm not the best researcher, but this is what I want to work on.
Yeah.
And again, I think that they appreciate that in
Yeah,
my business.
absolutely.
So.
Yes.
So, okay, Leah did a great job of breaking down the 7 legs,
Oh,
seven
wow.
of them. Count them, guys. Go back. But the 7 legs to this residency program, right? Everything that it entailed. And so let's talk about some work/residency life
Yeah.
balancing. How did you feel like you were managing your home life, your
Yeah.
personal life as you were in this 1 year intensive residency program?
Yeah. So, I mean, I think Hannah and I were talking about how we were going to present this piece because honestly, there's no sugarcoating it. It's just like when you're preparing to go to get into PT school or OT school. You know that you're entering into a stage of your life where a lot of your time and attention and effort and energy and sleep or lack thereof is being really poured into a certain aspect and a certain endeavor. So Hannah and I decided that we were not gonna, say it was easy, it was a breeze, because nothing worth earning comes easy, right? Or there's some quote like that, right? So it's definitely something where it's gonna be a lot more than your standard job where you come in for OTs. You come in at 7 and you leave at 3:30. Your charting ends there and you get to go home and be done with the day. That's a standard job, and that's what Hannah and I are at now, and we love it. But um with this, you're signing up for putting in the extra hours, going the extra mile, spending the time outside of your regular 8-hour day where you're going to be putting in that time. That being said, I think both of us really had that realization, just like we all do in OT and PT school, of how important that work-life balance is. I think, I tried to prioritize making sure that although I was putting a lot of hours and time into fellowship, various things, was that I was, continuing to work out. I know that that's something that Hannah and I talked a lot about. Like you gotta take care of your own body in order to take care of other people. And at the end of the day, even though we were doing these fellowship and residencies, we were still taking care of patients, and we had to kind of make sure that we were taking care, that self-care aspect, right?
Right.
And then also just making sure that you're still seeing your friends and family, like making sure that you're taking that time away and giving replenishing your batteries so that we could continue to serve others well and also show up as our best selves as the fellows and residents. So basically all that to say, it's going to be a lot of work, a lot of time, but there is that is so important that we were also trying to find how can we integrate that social aspect, that physical activity aspect that we needed to make it all the way to the end. So I don't know if that was a good response or not,
It
but
was a great response. No,
yeah.
I
Yeah.
totally agree. Like it was difficult. There was a lot to do, like Leah said. Even though we had just kind of like a half of a caseload.
Mhm.
So you said that you were from like 7:30 to 11:30.
Yeah.
Usually I was from 8 o'clock to 1 o'clock. So we had like an hour lunch break, and then I would see like one patient after, and then
Mhm.
I'd, pretty much be done with the day. Um, but yeah, the day did not stop there, right? Because you'd either have mentor meetings, you would have When we started getting later into the residency, you'd have to start working on your scientific paper, your case study, right? There was always something to do. There's always something to study. There's always something to read over. There's always something to prep, right? As Leah mentioned earlier, we had what's called a journal club each month. And so just to kind of give a little bit more explanation of that, basically from the rotation that we were currently on, we would try to find a journal or an article that spoke about, that neurologic condition, right? So let's just give an example. If we were on the spinal cord injury floor, right? Let's find an article that talks about spinal cord injury. If we can, let's find one that talks about this particular setting that we're in, which was inpatient rehab. And then let's talk about something that actually is applicable to our clinicians, right? So it's great if you find an article about spinal cord injury in inpatient rehab that uses, I don't know, VR technology, right? But if we don't have a VR system, like it won't carry over, it won't apply to our particular clinicians, right? So we need to find something, the newest research, because you're thinking, okay, if this is an article from 10 years ago, not that it can't help us, right? But we're assuming maybe these clinicians have already read this article, have already discussed it, right? But what is new out there, right? And so it's Leah and I's job to find out that new research that's out there, something that's from within the year or within, 2 to 3 years, right? Like whatever is like as new as
Yeah.
possible, but also relating to, like I said, the setting that we're in, the environment, the patient population, but also what are the clinicians interested in learning, right? What do they feel like they're lacking in? And so that was a time for us to go into the article, kind of give our critical appraisal, our analysis of the article. What were the strengths of the article? What were the weaknesses, and how can we apply this to our current practice, right? That's something that we did every single month. And if you got behind, you're doing two a month. Okay. I think I've had a couple of those. um, and then you had your case review, right? Which was each month you would pick a patient to talk about. And so, whether that was at the beginning of when they arrived to the facility or whether that was like post discharge, kind of talking about the aftercare or just kind of what could I have done better in this case, right? You would basically pick a patient. You would use that ICF model, or what's the OT version?
OTPF.
The OTPF, right? You would use that model to basically break down the patient, right? Again, here are their impairments, here are their strengths, the barriers, XYZ, all that stuff, right? And then you would also create 2 to 3 clinical questions, okay? Your clinical question, oh, this is giving me flashbacks.
I know, I know that
Your clinical question is basically, what is there more to know about this patient, right? Or what there, it's just a particular aspect of this patient, of their plan of care that you are looking into, right? How can you better serve this person? So I think, I can't remember. I'm trying to give an
Yeah.
example of a clinical question. I'm drawing a blank, right? But I remember just one off the top of my head. This individual, it was a neurologic condition. She also had a ton of orthopedic problems as well, spinal deformities, all this stuff. And so I was just like, look, where do I even start with this patient, right? And so obviously my clinical question was a lot more articulate than what I'm saying right now.
Yeah.
But you develop your clinical question and then you find research to figure out how to answer that question, right? And so you're going through articles, you're reading it over, and you're kind of compiling information together to figure out, okay, what is the next course or the next part of my intervention, or what could I have done better in treating this person, right? And not only do you have the clinical questions and you do the research on the clinical questions, you all that down, you put all your references, and you have the charts, right? You then also create discussion questions for your clinicians, right? So this is what the research is saying. What are you guys seeing, right? Or how would you guys approach this case? What would you guys do differently, or what do you think about this research? What do you guys think? Can we implement this? Is this something new? You just have those discussion questions. But yeah, that was every single month. And again, if you got behind, it was 2 a month. Anyway, so I think it was required to do at least 10. You had to do at least
Yeah.
10 journal clubs and 10 case reviews. And the
Instant.
right. And the thing was, sometimes you would switch rotations in the middle of like the month, right? And so you might do two because you were on this rotation and you have to go to the next rotation and you're doing another one. So sometimes it just worked out like that, right?
You
Uh
just reminded me of the eighth leg that I forgot about.
oh, the eighth.
Years
Sorry guys, not
ago.
seven, 8 legs like a spider. What is it?
I forgot about it. I had a passing thought and then I remembered it. They also would love you to be able to attend a conference or some kind of professional development opportunity. So I know that Hannah did something like virtual or something, but
Mhm.
I had the chance to go to our big conference, our big national conference, which is AOTA. They did pay a part of my way there, but just to be involved in some kind of state or national level experience or conference or continuing education, um, going to something like that and being part of like the bigger um, organization community of OT or PT. So that's
Yeah.
the eighth leg.
That's the eighth leg. Yeah,
Yeah.
our conference was in San Diego. And as fun as that would have been, I was like, oof, your girl ain't got San Diego money or the body right now. So we will do CMS online. But yeah, which conference did you end up going to?
Yeah, so that's our the AOTA is American Occupational Therapy Association, our annual conference. So I went to St. Louis, Missouri. I'd never been to Missouri before, and I did like 2 whole days of like 8 hours each of continuing education. It was really fun because I ran into some of my professors from all the way from Washington State and Missouri, and ran into them and just had, drank from a fire hose of OT wealth and knowledge. So it was overwhelming, but in all the good ways.
That's awesome.
So
That's
yeah.
awesome.
Hmm.
Yeah. Yeah, but just kind of going back to what we're talking about, there's just always something to do, right? We're talking about work-life balance, right? So we're going on a like a just this tangent hole, but there's always something to do, right? Leah talked about we were able to follow the physicians, right? Or like when they were rounding on patients, which I thought was really cool. So just kind of see from a medical
Mhm.
standpoint, what are they looking at? How are they evaluating this person? What are their anticipated prognosis for this person, right? That I thought that was a really really good insight into just hanging out with a doctor for a day, just kind of seeing. And I was like,
Yeah.
I know you, but I'm not here for PT, I just thought that was a fun
Yes.
part. What else did we do? We talked about volunteer experience, and so
Hmm.
yeah, let's get into that real quick. What volunteer opportunities did you do?
Yeah, so I thought this was really fun. Our particular facility has an amazing adaptive sports
Yeah.
um, kind of program. So, I mean, for the fellowship, they said, any you can seize the opportunity for any volunteer opportunity that would be relevant or related to this fellowship experience, neuro specifically. But I kind of took the like, oh, this is already an established thing, and I went through our adaptive sports program. So I did a 6 week adaptive yoga where I was like part of this adaptive yoga class, but then was like a hands-on um, participant in terms of positioning and modifying exercises. There was an adaptive yoga instructor, so I definitely was not instructing, but I was like helping with like positioning and stretching and making it so that everyone could participate. So I did that. It was like six weeks, but like an hour a week. And then I also got to do adaptive zip lining. So
I
that was
didn't
super
know that.
cool.
That's so
Yeah.
cool.
Yeah. So the requirement is 3 events. So my little 1 hour ones didn't count for six, they counted for like a partial one. So I did, yeah, adaptive zip lining, I was like, I don't even know how that's going to be possible, but in the world of adaptive sports, anything they can always adapt it, which
They
is
can
so
always,
cool.
which is so cool.
Um, yeah. And then the third one that I did was I was a ball runner at the Midwest Conference or something like that, tennis adaptive tennis championship. So I got to be right in the action and all this in the sets and try not to get hit by a ball as the
Right?
really phenomenal tennis wheelchair athletes were doing their thing and doing their stuff. So it gets you out in the community, kind of gets you interfacing with people that have our inpatient rehab patients are out living their lives, living their life to the fullest, quality of life, all that jazz. So it's kind of it pulls it all together. Like, yes, this is why we're advancing ourselves because we want to be able to contribute to these communities. So
Dude, that is so cool. I didn't know that you did zip line. Wow.
yeah, it was
That
awesome.
sounds so cool.
Yeah,
I can only remember two of mine. I was like thinking, I know I had three, but like
yeah.
right now my brain can only compute two. So, I think because they stuck out so much. So, I was able to witness wheelchair rugby, which I was
Oh
like,
yes.
what?
Yeah.
I mean, these people, they had like shields on their it like literal shields on their wheelchairs, and they would like crash into people. It was like boom, like a super loud noise, you know. But yeah, I was able to like work the scoreboard with that, which I had no idea how to do. And I was like, okay, point. I was like so involved in the game, they'd be like, point. I was like, oh yeah, 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 I got it, you know.
Yeah.
There were some really good teams out there. And then the second one that I got to do that was so, so fun was adaptive kayaking. And so
Oh yeah.
I remember I was super nervous because I was like, listen, I don't know how to save anybody from some lake water, you know what I mean? But they're like, no, you just have to like ride alongside with them, you know, and it was a pretty like easy going river. There was not like, or I think it was just a lake, honestly. So it wasn't like flowing water. It's just, you know, still water. I was like, oh, I can do this, you know. But it was so, so fun. And just like, especially this population, I believe they were mostly amputee patients. And so just having like adaptive equipment to get them in, you know, whether it was an arm amputee or a lower extremity amputee, just kind of figuring out how to problem solve that and that they can still do the normal everyday things that, you know, you and I can do, which was so, so cool. So I definitely appreciated those experiences for sure.
Yeah.
Okay. What else? We're still talking about life balance, you
Somehow
know,
we got on a
working.
rabbit trail of
I
all the things,
know, but
but
these are all the things that, like,
we're giving
yes,
you.
you will be busy. You'll be busy, but you still need to make time for friends, family, like Leah said, working on yourself, personal care. There were just days where I was like, you know what? I cannot do any residency things. Like, I cannot study, I cannot read, I cannot work on my paper right now. Like, today is solely about like taking care of Hannah, you know, going out with friends. Like, I was fortunate enough to meet a couple friends here where they have no relation to the residency, they have no relation to healthcare. And for me that was just nice because I was like, I can just completely disconnect and just have, you know, that moment where I can just like be with somebody and talk about like non-medical things, you know, which was just good for my own mental sake. So guys, if you pursue the residency, just know it's very intense. It's a year long, like Leah said, 12 months exactly. Okay. Like I started in September and I ended in September, okay. Um, but just know that as you're going through it, there are moments where you can seek time for yourself. Um, Make sure you carve those moments into your schedule. But then also just know that time for yourself, you can't make that the whole week, right? Because then you get behind with things, you're rushing, you're procrastinating. And so time management is something that I just typically struggle with anyway. And it's just a huge component of this residency. You're always time managing, you're always okay, this is my long list of things to do, you know, let me get this done a little each day, that way, you know, on XYZ day I can sit back and relax a little bit. So
Yep.
but I will say life after residency and time management and life work balance, whew, it's night and day, night and
Yeah,
day,
it is
right?
night and day.
So, because I think that maybe I would do like, you know, 20 to 25 clinical hours, right? So that's my patient care time where I'm actually, you know, in the facility working with
Mhm.
clientele, right? Let's say 25, I think that's what it was. But I would be putting in, you know, 45 hours, 50 hours, 60 hours sometimes a week
Oh,
in terms of my, because we had a, a log of like where are we devoting most of our time in terms of the residency. Are we doing it for our paper? Are we doing it for didactics? Are we doing it for our clinical care hours, our mentor hours? We just had this like breakdown, right? Just to make sure that we are on track for everything.
yeah.
And yeah, there are some months, especially towards the end, I was like, oh, this was a 65-hour week. Okay,
Yep,
got
yep.
it. You
Oh
know what I
yes.
mean? It doesn't stop just because it's Friday, because you still have that paper to write, and the you still have the case review and all the things, right? And
Oh, and
so,
grading too. Grading for students. We had
oh,
that.
I didn't have to do that.
Yeah.
I did not have to grade, thank goodness. No,
Wow.
so okay, well, I'll talk about that real quick. So you talked about being with the students. I also had a partnership with the local university here. And okay, first of all, I was so jealous because I was like, this is your PT program. This is way better than mine. I was like, oh my gosh, why did I go to this PT program? Right. And so sometimes I felt so bad. I was like, I have never seen this. I'm learning with
Yeah,
the rest of y'all,
yeah.
which is the purpose of a residency. But also I don't like to look foolish in front of people, and not that I did, but like some of the things I just felt like I couldn't speak on. I hadn't had that experience yet in person, and I was like, we didn't talk about this in my program, so I don't really know what to say, except for like what I've read in my didactic studies. And so yeah, I thought that was a really, really good experience. Like Leah said, a lecture, whew, I have so much more respect for my teachers, man. So
Mhm.
my lecture was only an hour. You said yours like 4 hours?
Like I had to prepare 4 hours of content. So like the lecture was an hour, but then the content I had to make sure was like 4 hours of activity. So
That's intense. Okay.
that was scary.
Yeah, I had to create a lecture. My topic study, I chose functional neurologic disorder. It's really, really interesting. We're not going to talk about it right now because we're going to get to some other stuff on this podcast, but it's a very, very interesting disorder. Anyway, so just like looking up all the things, I had a patient who had that, and so I kind of like tied in their patient case study with my lecture. And yeah, I just was like, man, this is really intense. Like, not only do I have to like provide information and
Oh,
educational pieces, I also need to be engaging, that way they're not just like sleeping as I'm rambling on.
yeah.
Make it interesting, even as far as going to like, I mean, this probably sounds obvious, but it's also having like a good PowerPoint, right? Because we've
Right.
all had those
Totally.
professors who just have like the blank white PowerPoint with just words, right? And like
Yeah.
that's not engaging at all. Those are the like usually the lectures that like, at least for me, I can't speak for others, I would tune out of, because I'm just like, I can read off of a PowerPoint. Like I can read. So just
Yeah.
send me this thing and I'll go home. Why am I in a lecture? Right. So I had to like make it appealing, throw questions in, try to get some student engagement. And so yeah, I just really have way more respect for my teachers because that thing was intense,
Yeah. Yes. Yeah.
and also, I was a little like, I don't feel like I have much stage fright, but I was a little stage fright. Like I was
Yeah.
a little
Scary.
nervous to be in front of these individuals. And I was, I think again, as a new grad, I'm like, I just graduated and you want me to teach people who are in PT school. Like y'all know I just graduated, right? Like it's not even like the ink is not fresh. You know what I mean? I just graduated, just got this program. Y'all want me to teach other individuals? Wow. Okay. Okay. But I will say that the confidence it builds afterwards was actually pretty amazing, because I was like, okay, I have a lecture under my belt, right?
Yeah.
Not that I have a big head at all. There's obviously a lot to improve, a lot to learn from that experience. But overall, I just think that it was a good experience helping you get out in front of people. I
Yeah.
think they say that if you can teach somebody it, that's how
Mhm.
you know that
Oh, yeah,
right? And
for
so
sure.
I felt like I really got that from doing the lecture. So
Yeah.
yeah. Do you have any comments on your lecture that you gave? Your
Yeah.
4 hour of content lecture?
Well, okay, so it was like so I gave a lecture on the 10 aspects of neuroplasticity, which are
Ooh.
like it's like the golden like I don't know if I should say this. The 10 commandments of neuro basically of like how basically the bones of what drives every really, really good neuro reeducation intervention. So I feel like I got a much better understanding of the 10 principles of neuroplasticity by preparing and teaching this lecture. I feel like I'm someone that like it's kind of an interesting way to learn, like preparing to be able to explain it to other people. You learn a lot about it yourself. So yeah, so I did a PowerPoint on that, gave a lot of like firsthand clinical examples that they could kind of draw from and understand about. And then they ended up doing like kind of some neuro-based assessment exploration during that session. So, and then I pulled in some examples and all that kind of fun stuff. So
Nice,
yeah,
nice.
yeah.
Yeah, so kind of like moving into our next question. This is a great segue. Let's talk about like the highlights of this program,
Yeah.
right? So I would definitely for myself consider, the lecture as a major highlight that I did. That's something
Mhm.
that I would have never felt like I had the opportunity to do. How many of like not trying to brag, but my cohort who we recently graduated, we're not even a full 2 years into this yet. How many of my other classmates can say like, yeah, I've taught a lecture before, it's just one, but I've taught a lecture.
Yeah.
So I feel like for me personally, that was a huge, huge highlight of, being able to complete this residency. I have another one, but I'll let you go first. What is a
Okay.
highlight of yours that you were able to achieve in this residency program? Or
I
sorry,
think,
fellowship.
yeah, yeah, no, it's okay. I
Same
think
thing.
there's, I mean, I think there's a lot, but I think just the opportunity to like build collaborations with so many people. Like I feel like in therapy, the therapy world, like the collaborations that you build with people is like gold, right? Like as a still relatively new practitioner, like figuring out who you can go to for questions and who you can go to for like moral support and like support, I don't know, like so I think that as the resident and the fellow we were just poised in such a cool position where we got to like know so much of the hospital. Like
Mhm.
usually when you're in a position you get in one team and you get to know that team and you're really kind of in that little bubble of that unit and that floor, but I'm very much a people person, but I love the fact that we got to know like four units of therapists and nurses and
Yeah.
doctors. And then by the end, I'm like, Hannah and I know everybody at this hospital. Not
Yeah.
true, but that's kind of how it felt. And
Yeah.
it's just such a unique, like interdisciplinary experience, a unique experience for so many ways. But just from an interdisciplinary standpoint, like I felt like it's a very unique position to be in where you get to interface with so many other professionals and make connections and make bonds that last for a while. So
Yeah. And like piggybacking off of that, the
Mhm.
observations within those
Yeah.
rotations, right?
Mhm.
So like being able to see, I don't know, like I got to see like a swallow study. I got to see
Yeah.
driver's rehab. I got to see just so many, different things that I probably would have never seen if I just worked there as a regular clinician, excuse me, that we had the opportunity to see,
Yeah.
right? And just
Yeah.
observe.
Yeah.
I was gonna say we kind of touched on this. A big highlight for me, girl, was finishing that research paper. I just looked at
Woo!
that thing the other day. That thing was 37, count them all, 37 pages long. And yes, that includes the references as well. But 37 pages.
Yeah. Yeah.
No,
Yeah.
I was just looking at that the other day and I was like, wow,
Yeah.
they did that thing, like
Yeah.
obviously, not to say obviously you don't know this, but not well, obviously you do, but the the listeners don't. So we did have a scientific inquiry personnel who assisted us with writing this paper, not so much writing, but editing. We wrote it, but they
Yeah.
assisted with editing, kind of maybe phrasing, wording here or there. My scientific inquiry person, she did, she was like, I think this sounds better. So she rephrased some things in my paper. But for the most part, I had to come prepared and ready with these drafts. I distinctly remember it was at least 3 edits per section, right? So you have your background, you have your methods, all the sections, right?
Uh,
At least three,
yeah.
at least 3 edits per section. So it was a very intensive process. It took the course of months, right? First of all, you had to figure out what is it that you even want to do your research paper on? And so my particular one was about a stroke patient, but more than just stroke, it was talking about the interdisciplinary process, right? And so you mentioned that too.
Yeah.
Interdisciplinary, guys, just meaning that not just treating this person as a physical therapist, but how can we, again, looking at the whole individual, right? How can me as a physical therapist work with his occupational therapist, work with his speech language pathologist, work with all of the team members, the nurses, the doctors. How do we all play an integral role in getting this person home and getting them better and getting them walking from whatever diagnosis they had, right? And so my paper focused, it was kind of cool. It was half on, this patient and his recovery process, and the statistics and the typical outcome measures that we use, the Berg, his 6-minute walk test, all that kind of jazz, right? Talked about all of those things from a PT standpoint, but then also talked about how I connected with the rest of the team, right? So I had to make personal meetings with his OT and his speech therapist to like, okay, what are you doing? What are the areas that you're still finding that is challenging for him in sessions? And how can you do what I need you to do in your sessions, right? So that kind of just that reciprocal role that we can play and helping each other out to not look just through our own silo or our own discipline, but to really expand and to broaden for this patient, right? To get them the most practice that they can get, right? So if this person is able to stand, well, in speech and OT, have them standing, right? Because that helps me as a PT out. It helps with their balance, helps them get stronger, right? And then vice versa. If there's something, a cognitive task that I can do as we're walking, but that also helps out the speech language pathologist, or if I can, we're doing a balance activity and I can get them to start using some upper extremity movement that also helps out the OT, right? And so
Woo!
as an interdisciplinary team really work together. And so when that paper was done, I was like,
Hannah and I did the
and done.
biggest
So it's
happy
like
dance.
close the computer forever.
Woo!
No, it was great. I can say that now, but it was good. It was good. It was definitely
Yes.
like though something that I would
Yeah.
have never thought again that I would
Mhm.
do, especially so soon after graduation. I actually just read a book. I did like a book review on this podcast, but this gentleman, his name is Dr. Scott A. Small. He has written over, I think it was like 46 research papers, and I was like,
How?
oh my gosh, I was like, even if you are a collaborator or co-writer, that's still so intense. I was like, and I can
Yeah.
speak to that because I've
Yeah.
written one.
I know, man.
I was like, I can attest that that is a lot,
Yeah.
it's
Wow.
crazy. But
Yes.
any other highlights that you have in completing this program?
I just think that well the piggybacking on Hannah is all the things that she said about the research paper. Yes, ditto to that. But we also got to do a continuing ed. We got to do a presentation on that. That was for continuing education. I'm like, never in a million years would I have believed that I would be in a position to be able to do a presentation to an interdisciplinary audience, doctors, nurses, therapists. That could count for continuing ed. I don't know if I'll ever
Yeah.
be in that position again, but that's pretty cool. And then I just think the mentors that I gained too through it. Like we said, the mentorship was like the golden egg of the whole experience was just the mentorship that we gained as part of it. So
Yeah, exactly.
yeah.
I think I just thought of this as you were talking, another part, not only did we write that research paper, but we were presented on it, right? So I
Yeah.
think just like in general, just becoming more comfortable with sharing information,
Mhm.
sharing research, right?
Yeah.
We had to do that for our journal clubs. We had to do
Mhm.
that for our
Yes.
case reviews,
Yeah.
right? And then for our
Yeah.
case report or our scientific inquiry paper, like we not only wrote that, but we also shared the information with other clinicians, and they
Mhm.
were live in person or they were on Zoom, right?
Yeah.
And they were live in the sense that they could ask real questions. I was like, oh,
Mhm.
that's a great question.
Yeah.
Yeah, and had us
Yeah.
thinking on the spot about, the different just different ideas that,
Yeah.
that they presented. And so yeah, I just think that
Mhm.
overall not only am I more comfortable, there's obviously still a long way to go. I can still be a lot better in researching techniques, and doing more research, but I think in general, it just made me one, a better researcher, and two, more knowledgeable in sharing that research with
Yeah.
others. And so
Yeah.
it gives you that confidence, right? That little.
Yeah. I think you're so right. Like I feel like we as far as our ability to speak on and advocate and communicate our about our profession, like you said, there's so many expectations on us to be able to communicate with interdisciplinary and to present on all of these things that we like practice makes perfect. We presented so many things to so many people about so many different topics. Uh,
Yes.
and so, like, I feel like now I'm able to articulate and talk about OT topics to others just so much better than I did a year and a half ago. So,
Yeah. No,
yeah.
I definitely agree. I agree.
Mhm. Yes.
Okay, so kind of starting to wrap this interview up. We talked about a lot of highlights. Any, barriers or any challenges, we should say, to completing a residency program or a fellowship?
Honestly, I mean, I think it's probably the elephant in the room, but it just comes back to the time. I mean, I don't think it's a negative thing, but it is ultimately not sugarcoating. It is a lot of time and effort, but we've already talked about all of that. But I think that that's something that probably is obvious, but um that's a big component, however you want to look at it, is it is a lot of time and effort and work, but ultimately so worth it in the end. But
It
yeah.
is. And
Yeah.
I'll give a little bit of advice to potential applicants out there. Just keep going, just keep driving.
Yeah.
I'll be honest, guys, I had been in school for so long, right? I took an untraditional path. I was in like undergrad, I think, for about 5 years. And then I went right into PT school, which was another 3 years, and then right into the residency. So I'm already 9 years in of like, and okay, not even counting like, middle school,
Yeah.
like just as an adult, I'm
Yeah.
already 9 years into schooling, right? And so there was a moment where I was just like, oh my gosh, I don't think I can go anymore. I don't think I can
Yeah.
do it. And I had a wake up call in the residency. They're like, hey, get your stuff together, right? And I'm like, okay, and I just had to kick it into gear, right? A saying that I saw somewhere, but it's you didn't come this far just to get
Yes.
this far, right? And so
Yes.
I just kept telling, I was like, we didn't come this far just to get this far, I'm gonna finish this thing out strong or as strong as I can.
Yeah.
And so just it's gonna be a lot. You might run out of gas sometimes, but make sure you're taking those moments to fuel your tank, and get it back into gear, right? Because it's such a great program. And like I said, just kind of looking back, there are aspects where I really could have taken advantage a little bit more of what I had available. I was just so tired at the time that I couldn't see it, but all in all, still looking on the other side of the residency, I made it. We made it, Leah. And
Yeah.
it's it's really interesting what I know in comparison to my cohort, in comparison to other new grads that I work with. Um, I just feel like I can bring a little bit more of that clinical experience. I've seen a lot of different neurologic conditions. Even though we might be on a certain rotation, we are still seeing potentially other neurologic conditions.
Mhm. Mhm. Mhm.
Not all of our patients have that particular diagnosis of stroke, spinal cord injury,
Yep.
brain
Mhm.
injury, vestibular, right?
Yep.
So we're still seeing other neurologic conditions as we're going. And again, that just makes you a more skillful
Mhm.
practitioner, right? And
Yeah.
so, in that sense, it was really good. But
Yeah.
yes, I would say that is the biggest barrier:
For
time
sure.
and your energy to continue going. It's time management, it's a lot of work. But when you're done, it feels really good. So,
Yeah.
and you know so much more than you would have thought, and you gain confidence in yourself, right? um that you probably, again, for me as a new grad, that I wouldn't have
Oh
had
yeah.
without the residency program.
Absolutely. Yeah.
Yeah. We kind of talked about this in one episode, but let's talk about, are there any financial considerations that someone should look into before
Yeah.
considering a fellowship or residency?
Yeah, wonderful question. Because when it boils down to it, money makes life go round and makes the
Yep.
world go round,
Yep.
right? So, um, a lot of also obviously like we're speaking from one particular fellowship residency, but for this fellowship, for both of us, I'm assuming, basically, the fellowship or the residency, you are paid as a full-time employee with full benefits. That's like priority one, right? As a young professional or whatever you are, you want to be able to have benefits and you want to be paid full time. So full time salary benefits. However, you can know going into it that your pay is going to be a bit different than you would be for a standard full-time OTR or DPT position, just because they're taking into consideration that you aren't autonomously doing a full caseload on your own. You are getting that support and mentorship from others and all these extracurricular experiences and all this extra bonus that you would as if you were in like a structured program. So full-time benefits, salary, but at a kind of a lower pay. But honestly, I looked at it as, because I came in having been a full-time salary full on OTR with OTR pay, I looked at it as kind of just an investment. Like I was like, okay, this is 1 year where my income is going to go down a little bit, but it's going to drastically influence the opportunities that are available for me and my ability to continue forward in this profession as to the best of my ability. So I kind of looked at it as an investment. And then also there's really the perk of it is it's not like you're having to put down a bunch of money for tuition for school. So it's
Yeah.
basically a lot like school in terms of you're getting this experience, but it's not like you're paying thousands of dollars for credits or tuition. But if you think about it in terms of the pay cut as like that's kind of the tuition, it all shakes out. You're like, okay, I'm not paying a big sum of money tuition wise. I am getting a pay cut, but in the end, I mean, it all kind of balances out. So
Yeah.
no big tuition. I think for OT, the tuition, which sounds like glorious, it was like $100 because I had to be on MedBridge or something. And I was like, that's it.
Right.
So
I was like, that's
yeah,
it for
so there's
school.
no hidden for ours, there's no like hidden fees or anything. It's not like there's this like giant thousands and thousands of dollars of tuition, but when it all comes down to it, you are getting paid less. So you can kind of look at that as your tuition, basically. I think that's how I kind of looked at it.
Yeah. Yeah. I think for PT, it was like $200 because it was a particular
Mhm.
course again
Yeah,
that you had to take.
yeah.
And then yeah, I think I heard this somewhere, maybe I read it somewhere, but it was about like 70% of a typical
Right. Yeah,
salary.
you're right, Hannah. Yep.
Yeah, so something like that, 70,
Yep.
75. I
Yep.
want to say 70,
Yep.
but
I think it was
um
70. That sounds totally rings a bell. Yeah.
yeah, I think that's what it was. And so yeah, like Leah said, just things to consider. Obviously full-time benefits, but just that 70% pay. So listen, I was working for free as a student, so I was like, hey,
Yeah.
I'll take it, right?
Yeah.
And then when I got this check, I was like, oh, okay. I could see I could see where the 30% factors in. Yep, I can see that.
Yeah.
Yeah, so a lot better, but
Yes.
good. All right. Any like okay, let's talk about career opportunities. And so,
Yeah.
after pursuing the residency, I guess, how prepared did you feel in
Mhm.
terms of seeking another job? Like we already said, you chose to stay there, which I wanted to stay if I was going to be inpatient, but they didn't have any positions. Everybody loves their job too much, whatever. But so I did not stay, but I found a different facility through actually observing.
Yeah.
Yeah, so in this residency, guys, I had the chance to observe at my current facility, and I was like, okay, I like it here, right? And then
Yeah.
they were looking for people, and so that's where I found a job. But let's just talk about career opportunities in general.
Yeah.
Do you feel like you're more prepared after pursuing a
Yeah.
fellowship? Just kind of what are your thoughts?
Yeah. Absolutely. I mean, I feel like, yeah, like Hannah and I have alluded to, lifelong learners. I feel like I'm not going to be able to say, oh, I am the most confident OT in the world until maybe I've been practicing for like 35 or 40 years.
Yeah.
I know a lot more than I did a year and a half ago, but there's so much to learn. I've always, you always feel inept or whatever. But um that being said, I felt like I could jump right onto the team, inpatient, be given a schedule, and that's honestly kind of what ended up happening. Jump in, hit the ground running, be a skilled practitioner, be pretty relatively confident in what I was doing. I also took my first student, my first full OTR student. I'd had a CODA student occupational therapy assistant student in the past at my previous job, but I felt a little bit more equipped to mentor and to supervise and oversee an occupational therapy registered student. So that was a hoop that I jumped through. And then I feel like I am equipped now to pursue like more formalized like certifications that would have been oceans away if I had started where I was before the fellowship. So AOTA has like the board credential in physical rehabilitation. So that's something that I've considered. And then also just looking at various neuro specialty certifications that I could pursue, having this background that I am more neuro based now than I was prior.
Yeah, that's awesome. Yeah, I definitely feel like job opportunities, I didn't look too many places because again, the facility I observed at, I was like I could see myself there. I felt like a great fit. But I think that all the experience that we gained, right? Everything that we did, I made sure to put that on my resume. We've done
Yes,
lectures, we've
yes,
done a grand rounds presentation, we've done
yes,
so much, right? And we've seen so much. And so I think that that really opened me up to be the clinician I am.
yes,
And in my current facility, it's a transitional facility. So I get to still use a lot of my different skills. I get to see various populations. And I'm like, oh yeah, I've seen brain injury. Oh yeah, I've seen Guillain-Barré. Oh yeah, I've
yes,
seen spinal cord, and so I have a huge range of skill set that I can utilize to work with these individuals. And um, yeah, as I too am looking to pursue my NCS, which is the Neurologic Clinical Specialist Board Certification. I personally, I went ahead and I took a year off just because, like I said, guys, I had been in school for so long, so much knowledge, so much studying that I was like, I can't take it right now. It's only offered one time a year. And it was kind of soon after I finished the residency. And so I'm giving myself a break and I will take it next year. And hopefully by that time I'll be Hannah Patterson, NCS, DPT, all the abbreviations after the name. But yeah, I really truly believe that this program has given me so many opportunities to advance myself, to further learn, to grow. Um, that just I don't think that, not to say my cohort doesn't have that right now, but it's so hard, right? With just being a new grad and getting your foot in the water. Whereas, one of the reasons my facility hired me was because they're like, oh, you have experience in these conditions, right? And as a new grad, I don't think that I would have been accepted there. So yeah, tons and tons of opportunities. All right. Anything else you want to share, Leah? Anything else about the residency fellowship? Any advice? Anything? Any tidbits? What you got?
let's see. I'm just taking it all in.
I was like, this
I
was
mean, we're having like
flashback
we're
to.
having flashbacks. Yes. I mean, I think at the end of the day, it is an opportunity to really take your profession into your own hands and take the fate of your profession and your professionalism and your knowledge into your own hands, because at the end of the day, fellowships and residencies for PT and OT are optional.
Mhm.
So I think I feel like it's a really empowering step that you can take. It's above and beyond. It's the extra credit that is not required to be a PT and it's not required to be an OT, but it's that empowering step where you're like, I'm gonna take this year, I'm gonna set aside this time, sacrifice maybe a couple of things, money, time, social life, maybe a little, to really invest in myself as a practitioner so that I can be the best that I can be for my patients in the end. So I think it is empowering because you're like, I took this extra step beyond what is required to practice as a PT or an OT. And you're like, wow, I'm taking the extra steps. I'm going above and beyond. I'm doing the extra work. So I think that's cool to be able to say if you go that extra step of doing a fellowship or residency.
I totally, totally agree.
Yeah.
Yeah, I don't have anything to piggyback really. I think
Yeah.
we've covered it. We've covered the nitty gritty. The only thing the extra that I'll say was, guys, Leah was my battle buddy through this whole
Yes.
experience. We would text each other like, Oh gosh, girl, you struggling? Yes, I'm struggling.
Yes.
You struggle, but I'm just glad I'm not alone.
Yes. Yeah.
So it's really nice to have somebody, even though it's a different program, different discipline, it was still really nice to have somebody to share this with, to go through with. And now we are on the other side, still friends, still able to now we're able to laugh about this experience in a good way and be like,
Yeah.
wow, we really did that. So
Yeah.
I definitely appreciate that from you.
Yeah.
Yes, thank you, thank you. All right, guys. This has been a great episode. Oh my gosh, we
Yeah.
have been chatting along, but I hope this was super helpful. I hope this was interesting. If you're pursuing a residency slash fellowship, let us know. Comment in the section below, whether it's on Instagram or whether it's on YouTube. Yeah, reach out to us if you have any extra questions. We'd love to hear it, love to give you any advice that we can share. But I'm gonna go ahead and close this out. Like I said, this is Leah, OTRL. I am your hostess, Dr. Hannah P. And yeah, we're out.